Los Angeles, 1947. Dr. Eugene Carney sat in his office at MGM Studios, staring at a prescription pad. In the outer room, 19-year-old Judy Garland waited, sent by studio executives who demanded he provide medication to keep her working through another grueling production schedule. This wasn't the first time. It wouldn't be the last. Dr. Carney was one of several physicians employed by Hollywood studios during the Golden Age, and his job wasn't to protect the health of performers. It was to keep them functioning regardless of the cost. Decades later, in a deathbed confession to his son, Dr. Carney revealed the truth about what he and other studio doctors were ordered to do. What he described wasn't medical practice. It was systematic destruction disguised as health care. This is the story Hollywood's medical establishment tried to bury. To understand how doctors became complicit in Hollywood's exploitation, we need to examine the studio system's structure. Major studios in the 1930s and 1940s operated as complete ecosystems. They didn't just produce films, they controlled every aspect of contract players' lives. This control extended to healthcare. Studios employed physicians whose primary loyalty wasn't to patients, but to the studio's financial interests. These doctors operated under constant pressure to keep valuable properties working, regardless of medical ethics or long-term consequences. Dr. Carney's involvement began innocently enough in the early 1940s. He was a young physician, recently established, when MGM approached him about providing medical services for their contract players. The offer seemed attractive. Steady income, association with glamorous industry, access to wealthy clientele. What he didn't initially understand was that accepting the position meant compromising his medical judgment in favor of studio demands. The system worked through careful manipulation of professional responsibility. Studio executives would frame their requests in ways that seemed medically justified. A young performer was exhausted from long shooting schedules. Prescribe stimulants to maintain energy. The same performer couldn't sleep due to the stimulants? Provide sedatives. Weight gain from the sedatives? Add appetite suppressants. Each prescription seemed individually defensible, but together they created devastating cycles of dependency. Judy Garland became one of Dr. Carney's regular patients in the mid-1940s, though their relationship was hardly typical doctor-patient interaction. Studio executives would call his office with instructions about what they needed from Judy. More energy for a demanding dance number, better focus for emotional scenes, weight loss for costume fittings. Dr. Carney was expected to provide pharmaceutical solutions to problems that were fundamentally about overwork and exploitation. What haunted Dr. Carney in his later years, according to his son's account, was his awareness of what he was doing. He wasn't naive. He understood that prescribing amphetamines to teenagers created addiction risks. He knew that combining stimulants and sedatives was dangerous. He recognized that using medication to override the body's natural limits caused long-term damage. But the pressure from studios was immense, and doctors who refused to comply found themselves replaced by physicians more willing to prioritize studio interests. The financial incentives were carefully structured to encourage cooperation. Studio doctors received generous compensation far exceeding typical medical salaries. They gained access to wealthy Hollywood social circles. They were treated as valued team members rather than outside professionals. These benefits created situations where doctors had strong motivations to rationalize choices that contradicted their medical training. Dr. Carney described one particular incident that crystallized his moral conflict. In 1948, Judy came to his office showing obvious signs of pharmaceutical toxicity. Her hands shook. Her speech was slightly slurred. She appeared disoriented. Medical ethics demanded that he recommend cessation of all non-essential medications and rest. But studio executives had already called that morning, insisting she needed to be ready for filming the next day. They made clear that his job depended on keeping her functional. He provided the medications. Years later, he told his son that moment represented his clearest betrayal of medical ethics. He had chosen financial security and professional relationships over patient welfare. He had participated in harming someone who came to him seeking help. The guilt from that choice and hundreds of similar decisions never left him. What made the situation more insidious was how the system diffused responsibility. No single prescription seemed dramatically harmful. No individual decision appeared catastrophic. The damage accumulated gradually through countless small choices, each one defensible in isolation but collectively devastating. This diffusion of responsibility allowed doctors to rationalize their participation while slowly destroying the health of young performers. The pharmaceutical regimen that studio doctors prescribed to performers like Judy wasn't random. It followed calculated patterns designed to maximize productivity. Stimulants in the morning to enable early call times and sustained energy. More stimulants during long filming days. Sedatives in the evening to force sleep despite the stimulants. Appetite suppressants to maintain unrealistic body standards. Pain medications to work through injuries. Each category of drugs served studio interests while damaging patient health. Dr. Carney wasn't the only physician involved in this system. Multiple doctors worked for different studios, and they all faced similar pressures and made similar compromises. Occasionally, they would discuss their concerns privately, acknowledging the ethical problems with their practices. But none of them felt empowered to refuse studio demands or speak publicly about what was happening. The system was too powerful, the financial incentives too strong, the potential consequences of resistance too severe. What particularly troubled Dr. Carney was the age of many patients. Judy had been receiving studio-prescribed medications since her mid-teens. Her body never had the opportunity to develop normal regulatory systems without pharmaceutical interference. By her 20s, she was so dependent on these medications that stopping them created severe withdrawal symptoms. The addiction that would plague her entire life was created by doctors following studio orders. The system also prevented performers from seeking independent medical care. Contract terms often required using studio doctors. Even when performers could technically see outside physicians, studios discouraged this through subtle pressure and contract interpretations. This monopoly on healthcare gave studios complete control over the medical information and treatment their contract players received. As Judy's health declined through the 1950s and 1960s, Dr. Carney watched from a distance with growing horror. He was no longer her physician, having left MGM's employ, but he followed her career and struggles. He knew that the pharmaceutical dependencies and health problems destroying her had been created by the system he had served. He understood his personal culpability in her suffering. In his final years, Dr. Carney became increasingly troubled by his past choices. He spoke to his son about the moral compromises he had made, describing them not as excuses but as confessions. He acknowledged that financial pressure and career concerns didn't justify the harm he had helped inflict. He expressed regret that he hadn't found the courage to refuse studio demands or speak publicly about the exploitation he witnessed. What his confession revealed was systemic rather than individual failure. While Dr. Carney bore personal responsibility for his choices, he operated within a structure designed to compromise medical ethics. Studios created systems where doctors' professional judgment was subordinated to corporate interests. The healthcare these institutions provided wasn't medicine in any meaningful sense. It was resource management designed to extract maximum value from human capital. The broader implications extend beyond individual cases. The studio system's medical practices represented a perversion of healthcare principles. Doctors took oaths to do no harm and prioritize patient welfare, but when medical practice becomes subordinate to corporate profit, those principles become meaningless. What happened to Judy and others like her demonstrated how easily professional ethics can be corrupted by institutional power and financial incentives. Today, medical ethics standards include protections designed to prevent such conflicts of interest. Doctors are expected to maintain independence from employers whose interests might conflict with patient care. Informed consent requirements aim to ensure patients understand treatments and their alternatives. Professional oversight bodies investigate situations where financial incentives might compromise medical judgment. These protections emerged partly from recognition of past abuses in contexts like Hollywood's studio system. But Dr. Carney's confession reminds us that institutional power can still corrupt professional judgment. When profit motives dominate healthcare decisions, when providers depend financially on entities whose interests conflict with patient welfare, the potential for exploitation remains. The specific circumstances have changed, but the underlying dynamics persist in various forms. The tragedy of studio doctors like Dr. Carney is that they were often decent people who made destructive choices within corrupting systems. They rationalized, compromised, and gradually betrayed their professional principles. By the time they fully recognized what they were doing, they were so enmeshed in the system that extraction seemed impossible. Their stories serve as warnings about how institutional structures can lead individuals to participate in harm they would never consciously choose. For Judy Garland, the impact of these medical decisions was catastrophic. The addictions created by studio doctors plagued her entire adult life. The health damage from years of pharmaceutical abuse contributed to her early death. The psychological harm from being treated as a product rather than a patient reinforced the exploitation she experienced throughout her career. Studio doctors didn't just fail to protect her. They actively participated in her destruction. Dr. Carney's deathbed confession couldn't undo the harm he had helped cause, but it provided testimony about institutional practices that Hollywood preferred to keep hidden. His willingness to acknowledge his failures and their consequences offers valuable historical documentation. It helps explain how systematic exploitation functioned at the medical level, providing evidence that what happened to performers like Judy wasn't accidental, but resulted from deliberate institutional choices. That truth matters, even when it comes too late to prevent the damage.